Welcome to the deep dive. Looks like someone's getting ready for that big medical school exam, huh? Surgery and oncology, that's some serious stuff.
Definitely a lot to cover, but we're here to break it all down, make it easy to understand, and help you ace that exam.
Sounds like a plan. So first up, breast cancer. You've got tons of notes on different classifications. What's the most important takeaway there?
Well, think of it this way. It's not just one disease. It's a whole bunch of them with different personalities. Classifications help doctors figure out the best way to tackle it and what the outcome might be for each patient.
Makes sense. So break it down for me. The notes mention invasive versus non-invasive, molecular expressions, and the Foot-Stewart classification.
Okay, let's start with invasive versus non-invasive. Imagine a garden, right, with a fence. Non-invasive cancer is like a plant that stays put within its boundaries. Invasive, on the other hand, well, that one's broken through the fence and could spread. The fence here is like the basement membrane of the breast tissue.
Okay, got that picture in my head. Now, what about these molecular expressions? What role do genes play in classifying breast cancer?
Genes, they can tell us a whole lot about a specific cancer. You know those BRCA1 and BRCA2 mutations? Famous for increasing breast cancer risk, right? But there are others like TP53, GHK2, CDH1, each linked to different types of breast cancer. That info is gold for deciding on treatment.
So knowing the specific gene mutation can guide treatment decisions. Okay, what about the Foot-Stewart classification? Sounds a bit more complex.
It is a bit, yeah, but think of it like categorizing apples based on how they look, right? You got
Okay.
your Granny Smiths, your Galas, your Honey Crisps. Each looks different, tastes different. The Foot-Stewart classification does the same for breast cancer. Adenocarcinomas, medullary carcinomas, mucinous carcinomas, each has its own distinct look and behavior.
Okay, I think those classifications are starting to sink in. But how does all this actually translate to diagnosis? What should someone be on the lookout for?
Well, most commonly, it's a lump in the breast. Often painless, feels hard. But don't just rely on touch. Skin changes matter, too. You ever heard of peau d'orange? Literally means skin of an orange.
Code orange. No, but it sounds pretty descriptive.
It is. The skin gets all dimpled and thick like an orange peel. Happens when cancer cells block lymph vessels, fluid builds up.
Okay, peau d'orange, I'll remember that one. What about nipple discharge? Is that always a cause for concern?
Could be, especially if it's bloody or happens on its own. But remember, not every lump or discharge means cancer. Benign breast conditions can cause those too. Bottom line, any unusual change, see a doctor.
Early detection is key, for sure. But once breast cancer is diagnosed, how do doctors figure out how serious it is and the best way to treat it?
That's where staging comes in. Picture a map, different zones. Staging tells us the tumor size, has it spread to nearby lymph nodes, any distant organs involved, like moving from zone 1 to zone 3 on our map. Crucial for planning treatment and predicting the prognosis.
Staging, a roadmap for treatment. Got it. Speaking of treatment, what are the typical options for breast cancer?
Well, it depends on the type and stage. Surgery is often the first step, from lumpectomy to mastectomy. Then there's chemo, using drugs to kill cancer cells, and hormonal therapy, which targets hormones that fuel certain types of breast cancer. Each has its pros and cons.
So no one-size-fits-all approach. Okay, let's switch gears to benign breast tumors. How do those differ from the cancerous ones?
Benign tumors, they're abnormal growths, but think of them as well-behaved house guests. They don't invade nearby tissues or spread. Like a fibroadenoma, common one, especially in younger women, feels smooth, rubbery, and it moves around.
So just a harmless bump. The notes mention Phyllodes tumors too. How are those different?
Phyllodes tumors, they're benign too, but they can grow fast and feel firmer, more common in older women. Think of them as a house guest who overstays their welcome and needs a bit more attention.
Interesting analogy.
Mm.
So how are benign breast tumors treated? Is surgery always needed?
Not always. For a fibroadenoma, if it's small and not causing trouble, just watching it might be enough. But if it grows quickly or causes anxiety, surgery's an option. Phyllodes tumors, well, they're usually removed, just in case, even if the chance is small, to prevent them from turning cancerous.
Makes sense. Okay, we've covered a lot about breasts already. Now let's move on to another area where surgery's vital: hernias. So what exactly is a hernia?
Picture an inner tube poking through a weak spot in a tire. That's basically a hernia. It happens when part of your insides pushes through a weakness in the muscle wall, the wall that's supposed to keep everything in.
A bulge because something's pushing where it shouldn't be.
Ah.
Got it. So the notes talk about different types of hernias. Where do they usually pop up?
The most common one, inguinal hernia, it's in the groin, where your belly meets your thigh. Think of it like a weak spot in the border control of your abdomen.
A breach in the abdominal wall. Okay. The notes Also mentioned femoral hernias. How are those different from inguinal hernias?
Both are in the groin area, but femoral hernias are lower down, below the inguinal ligament, like taking a detour on a road trip, same area, different path. Femoral hernias are more common in women and have a higher chance of complications.
Okay, I see the difference. Now, what about umbilical hernias? The ones around the belly button, right?
Exactly. They happen when the opening for the umbilical cord doesn't close up all the way, more common in babies, of course. But adults can get them too, especially if there's extra pressure in the abdomen, like from pregnancy or being overweight.
Interesting. So a weak spot from birth or one that develops later on. What about perumbilical hernias related to the umbilical one?
Yeah, they are. Perumbilical hernias are near the belly button, often in the linea alba, that fibrous tissue running down the middle, like a seam that weakens over time, more common in adults.
So many types of hernias. Are there even more?
There are a couple more. Epigastric, which is above the belly button, and incisional, which happens at the site of a previous surgery. It's like the body's repair job isn't quite as strong as the original.
Okay, starting to see a pattern here. Weak spots can lead to various types of hernias. But why are they a big deal? Why do they need a doctor's attention?
The main worry is that the thing poking through could get trapped. Doctors call it strangulated. Think of a finger stuck in a doorway. Strangulation cuts off the blood supply, and that can damage the tissue, even lead to gangrene. That's a surgical emergency.
That sounds serious. So recognizing the signs is crucial. What should people look for?
Usually it's a noticeable bulge, more prominent when coughing or straining. Pain or discomfort, especially when lifting or bending, can be a sign too. And if it gets strangulated, the pain gets worse, the bulge might become tender and change color. That's when you need to get to a doctor ASAP.
Got it. A bulge with increasing pain. That's a red flag. Okay, let's shift focus to another part of the digestive system, the gastrointestinal tract. One condition in your notes is peptic ulcer disease. What causes those ulcers?
Peptic ulcers, they're sores that develop in the lining of the stomach or the duodenum, the first part of the small intestine, like tiny craters forming. A common culprit is that H. pylori bacteria. It's like a tiny drill burrowing into the stomach lining, causing inflammation and making it vulnerable to the stomach acid.
A bacterial invasion weakening the stomach's defenses. Are there other things that contribute to peptic ulcers?
Yeah, some meds, those NSAIDs like ibuprofen and aspirin, they can irritate the stomach lining too. Like repeatedly hitting a castle wall with a battering ram, it weakens over time.
Makes sense. So what are some signs that someone might have peptic ulcer disease?
The classic one is a burning pain in the upper abdomen, often eases up after eating or taking antacids, like a fire that's temporarily put out. You might also get nausea, vomiting, bloating, and even blood in the stool or vomit if the ulcer is bleeding.
Doesn't sound fun at all.
Yeah.
So how are peptic ulcers usually treated?
Treating that H. pylori infection is key, often with antibiotics and meds that reduce stomach acid, like proton pump inhibitors, like sending troops to fight the bacteria and rebuilding the castle walls. Lifestyle changes help too, like quitting smoking and avoiding those NIs.
A multi-pronged attack. But are there surgical options for peptic ulcers too?
Surgery is less common now because those meds work so well. But if an ulcer just won't heal or perforates, like a hole in the stomach wall, or causes a blockage, then surgery might be needed, like bringing in the big guns when the first line of defense fails.
That makes sense. Now, the notes also mention gastric outlet obstruction. What exactly does that mean?
It's basically a blockage that stops food from leaving the stomach, like a traffic jam in your digestive system. Could be from a few things: peptic ulcers, tumors, or even the muscle that controls the stomach opening getting thicker.
A bottleneck in the digestive flow. What are the signs of a gastric outlet obstruction?
Early on, you might feel nauseous, bloated, full even after a small meal. But as the blockage worsens, vomiting becomes more frequent, often projectile, with undigested food, like the traffic jam backing up, causing everything to spill out.
Sounds pretty uncomfortable.
Yeah.
How is it diagnosed and treated?
Doctors use imaging, things like barium swallow x-rays or endoscopy, to see the blockage, like sending in a scout. Treatment depends on the cause, but it usually involves relieving the blockage and fixing the underlying problem. Sometimes surgery is needed to widen the opening or remove part of the stomach.
It's fascinating how surgery can fix those complicated digestive issues. There's one more gastrointestinal condition I want to touch on. Infantile hypertrophic pyloric stenosis. What is that?
This one affects babies, mostly. The pylorus, the muscle connecting the stomach to the small intestine, gets thick and narrow, making it hard for food to pass through. Like a doorway that's been shrunk, much harder to get through.
So a muscular bottleneck, specifically in babies. What signs should parents watch for?
The most noticeable one is forceful vomiting, often shooting out, and usually happens soon after feeding. The baby might always seem hungry but not gaining weight because they're not keeping food down.
That's got to be scary for parents. What's the treatment for this?
The good news is there's a simple surgery, a pyloromyotomy. It's basically widening that doorway again. The surgeon makes a small cut in the thickened muscle, and that restores normal flow.
Amazing what surgery can do. Before we jump to urological conditions, there's something I'm curious about. Meckel's diverticulum. What is it, and why is it important when talking about surgery?
Meckel's diverticulum, a bit of a surgical oddity. It's a tiny pouch that can form in the small intestine's wall, usually near where it joins the large intestine, like a little side pocket that wasn't supposed to be there. It's a leftover from when we were fetuses, a remnant of the connection between the developing gut and the yolk sac.
So something to be worried about.
Not usually. Most of the time, it's totally harmless, doesn't cause any trouble. People often don't even know they have it. But sometimes it can get inflamed, bleed, or even cause a blockage. Imagine that little side pocket getting irritated or blocked. That's when it becomes a surgical problem.
Like a silent passenger that can occasionally cause trouble.
That's a good way to put it. But remember, most people with Meckel's diverticulum never have any issues. And if it does cause problems, surgery can usually fix it. The surgeon takes out the diverticulum and the bowel is stitched back together.
Okay, that's reassuring. So Meckel's diverticulum, a reminder that we sometimes carry around remnants of our fetal development that can surprise us later. But for now, let's dive into urological conditions. What are some common ones that surgeons deal with?
One that comes to mind is hydronephrosis. Basically, it's the kidney swelling up because urine can't drain properly, like a balloon slowly inflating inside the kidney. Happens when there's a blockage in the urinary tract.
So the urine backs up and creates pressure. What can cause this blockage?
Could be a kidney stone, a tumor, an enlarged prostate, even something you're born with. Sometimes it's scar tissue from a previous surgery or infection. Like a kink in a hose the water can't flow through.
That makes sense.
Yeah.
So how would someone know if their kidney was swelling up? What are the signs of hydronephrosis?
It depends. Sometimes there are no symptoms at all, especially if the blockage is partial or comes and goes. But if it's severe or completely blocked, you can get pain in the side or back, needing to pee all the time, even nausea and vomiting, like the pressure in the hose building up and causing trouble.
So those are the red flags. How is it diagnosed and treated?
Imaging tests, like an ultrasound or CT scan, can show the swollen kidney and where the blockage is. Like taking an x-ray of that hose. Treatment, you got to fix the root cause. Kidney stone, might need to break it up or take it out. Enlarged prostate, medication or surgery might be needed.
It's like plumbing for the body. Speaking of prostates, I know men often have problems with them, especially as they get older.
You're right. Benign prostatic hyperplasia, BPH, for short, it's incredibly common in men over 50. It's just the prostate getting bigger, not cancer. Think of a balloon slowly inflating around the urethra, that tube carrying urine from the bladder. As the prostate grows, it squeezes the urethra, making it harder for urine to flow.
So BPH is common, but not dangerous.
Mm-hmm.
What would a man with BPH experience?
He might have to push to start peeing, have a weak or interrupted stream, feel like he hasn't fully emptied his bladder, or get up a lot at night to pee, like trying to water your garden with a partially blocked hose, frustrating and inefficient.
And what are the treatment options for BPH?
Depends how bad the symptoms are. Mild cases, lifestyle changes like cutting back on caffeine and alcohol can help. Medications can relax the prostate or shrink it a bit, like adjusting the water pressure or using a special nozzle. But if it's severe, surgery might be needed to remove part or all of the prostate. That's like clearing the blockage completely.
So it's manageable, but then there's prostate cancer, a much more serious prostate condition. How is that different from BPH?
BPH is just enlargement. Prostate cancer, that's abnormal cells growing out of control and potentially spreading, like a weed taking root and scattering seeds. Early on, there might be no symptoms. But later, it can cause similar urinary problems as BPH, but also blood in the urine or semen, bone pain, and problems with erections.
That sounds serious. How is prostate cancer diagnosed?
Doctors use different tests, a digital rectal exam, a PSA blood test, and a biopsy. The PSA test measures a protein in the blood, prostate-specific antigen, which can be higher in men with prostate cancer. Think of it like a smoke alarm. It signals a possible fire, but we need more info to be sure.
And what about treatment for prostate cancer?
The treatment depends on the stage and how aggressive the cancer is. Could be surgery to remove the prostate, radiation therapy, hormone therapy, or chemotherapy. A team of specialists usually decides what's best. It's like creating a battle plan based on the enemy's location and strength.
Okay, so prostate health is complex, definitely needs careful monitoring. Now let's talk about the testicles. The notes mention testicular tumors. Are those always cancerous?
Not always, but testicular cancer is a real concern, especially for younger guys between 15 and 35. Think of it like a cell going rogue and growing without any rules.
What are the signs to look out for?
Most often, it's a painless lump or swelling in the testicle. You might also feel pain or discomfort there, or in the scrotum, a feeling of heaviness in the scrotum, or even though it's rare, breast enlargement. It's your body trying to tell you something's not right.
Breast enlargement in men. That's unexpected.
Yeah, it can happen, although it's rare. Some testicular cancers produce hormones that can cause that. But the main point is any weird change down there, get it checked out. Catching it early makes a big difference.
Absolutely. So what's the typical treatment for testicular cancer?
Usually it's surgery to remove the affected testicle, like
Yeah.
getting rid of a weed before it spreads. Depending on the type and stage, they might do radiation therapy or chemo afterward, just to be sure they got all the cancerous cells.
Okay, early detection and prompt treatment are key for testicular cancer. The notes also mention a seminoma, a specific type of testicular tumor. What's different about that one?
Think of seminomas as the less aggressive type. They tend to grow slowly and respond well to treatment, like dealing with a slow-growing vine instead of a fast-spreading weed.
That's good news, relatively speaking, if someone has to deal with testicular cancer.
Yeah, seminomas generally have a good outlook, especially if caught and treated early. But remember, every cancer diagnosis needs a thorough evaluation and a treatment plan tailored to the individual patient.
Absolutely. We've covered a lot of ground on urological conditions, but surgery obviously goes way beyond that. What about procedures in other parts of the body? Your notes mention circumcision. What's the thinking behind that one?
Circumcision, that's removing the foreskin, the skin covering the tip of the penis. Pretty common, but there's debate about whether it's medically necessary. Some say it lowers the risk of urinary tract infections, sexually transmitted infections, even penile cancer. Others think it's unnecessary and carries potential risks and complications.
So a decision for parents to make carefully, weighing the pros and cons. What about other common surgical procedures? The notes mention vasectomy.
A vasectomy, that's permanent birth control for men. Think of it as snipping the supply lines. It's cutting and sealing the tubes that carry sperm. Usually an outpatient procedure, local anesthesia, and pretty effective. But gotta emphasize, it's permanent. No going back.
A big decision, but a simple procedure. What about hydrocele repair?
A hydrocele, that's a fluid-filled sac that forms around a testicle, making the scrotum swell up, like a water balloon around the testicle. The repair is straightforward, a small incision, drain the fluid, and you're done.
Like a quick fix for a swollen scrotum. Okay, the notes also mention tracheostomy, which sounds a bit more complex.
A tracheostomy, that's creating an opening in the windpipe, the trachea, and putting in a tube to help with breathing. Like creating a detour for air to bypass an obstruction, often done in emergencies, like a blocked airway from an injury, or a severe allergic reaction. Sometimes it's needed longer term if someone has a condition that affects breathing or clearing the airway, like a spinal cord injury, stroke, or neuromuscular disease.
A lifesaver in emergencies, a long-term solution in other cases. Speaking of breathing, the notes mention flail chest.
Flail chest, now that's a serious injury, happens when several ribs are broken in multiple places and a part of the chest wall basically detaches and moves on its own. Imagine a section of a fence breaking off and flapping in the wind. Makes it really tough to breathe effectively.
So instead of expanding when breathing in, the detached part moves inward, what usually causes flail chest.
Usually it's a major blow to the chest, like in a car accident or a bad fall. The impact breaks the ribs and messes up the chest wall's structure.
Sounds painful and dangerous. What are the signs to watch for?
The most obvious is that paradoxical movement of the chest, that detached section moving inward while breathing in. You might also see bruising, swelling, and crepitus, a crackling sound from the broken bones rubbing together. The person will be in a lot of pain and struggling to breathe.
So you can see and hear the injury. How do you treat flail chest?
The focus is on managing the pain, giving supplemental oxygen, and sometimes putting them on a ventilator to help them breathe. It's like giving their lungs a helping hand while the chest heals. Sometimes they need surgery to stabilize the chest wall, basically fixing the broken fence.
Makes sense. Okay, moving on to another condition that can affect breathing, thoracic outlet syndrome. What is that exactly?
Thoracic outlet syndrome, or TOS, happens when the nerves and blood vessels get squeezed in the space between your collarbone and your first rib, called the thoracic outlet, like a busy highway suddenly narrowing down, causing a traffic jam. This can lead to all sorts of symptoms, depending on which nerves and blood vessels are affected.
A pinch point for important structures.
Yeah.
What are some common symptoms of TOS?
Some people have pain, numbness, or weakness in the arm and hand, especially when they raise their arms. Others might notice swelling or discoloration in the hand or arm, which means the blood flow is messed up. Imagine your hand going numb because it's not getting enough blood.
That's worrying. How do they diagnose and treat TOS?
Diagnosis often involves a physical exam, imaging like an X-ray or MRI to see the thoracic outlet, and nerve conduction studies to check how well the nerves are working. Treatment depends on how bad the symptoms are and the underlying cause. Could be physical therapy to strengthen the muscles and improve posture, or medication to relieve pain and inflammation. Sometimes they need surgery to remove a rib or free up the compressed nerves and blood vessels, like widening that narrowed highway.
Okay, so TOS is a condition with a range of symptoms, depending on which structures are pinched. Let's shift our focus now to the lining of the lungs, the pleura. One condition in your notes is pleural effusion. What causes that?
Pleural effusion is when fluid builds up in the space between the lungs and the chest wall, the pleural space. Think of water accumulating between two panes of glass. Could be caused by a bunch of things: infections, heart failure, liver or kidney disease, even cancer. It's a sign that something's wrong, like a warning light on your car dashboard. Need to investigate further to find out the exact cause.
So pleural effusion is more like a symptom than a disease itself. What signs should someone look out for?
Most often it's shortness of breath because the fluid's squeezing the lungs, making it harder for them to expand, like trying to inflate a balloon that's already partly filled with water. You might also get chest pain, coughing, and fever.
This is like a domino effect from that fluid buildup. How's it diagnosed and treated?
A chest x-ray can usually spot the fluid buildup. Then a thoracentesis, where they stick a needle in the chest to take out some fluid, can help figure out the cause. Treatment, gotta tackle the root of the problem. Infection, antibiotics, heart failure, meds to improve heart function, cancer, chemo, or radiation. It's like finding the source of a leak and fixing it.
Treat the cause, okay? The notes also mention empyema. How's that different from pleural effusion?
Well, pleural effusion can have many causes, but empyema is specifically pus in the pleural space, usually from a bacterial infection. That water between the panes of glass, imagine it turning cloudy with pus. Much more serious, could be life-threatening if not treated quickly.
Infection inside the pleural space. So what are the symptoms of empyema?
The symptoms can be similar to pleural effusion: shortness of breath, chest pain, coughing, fever. But with empyema, you might also have chills, sweats, and feel tired because of the infection. Imagine your body's fighting a battle against those bacteria. Takes a lot of energy.
That sounds rough.
Yeah.
What's the treatment for empyema?
They usually drain the pus, either with a needle or a chest tube. And antibiotics are a must to fight that infection, like draining a swamp and then fumigating it. Sometimes surgery is needed to remove infected tissue, like getting rid of the breeding ground for those bacteria.
A full-on attack to get rid of the infection. Okay, let's talk about another condition that affects the pleura. Pneumothorax, or a collapsed lung. I know that can happen if someone gets stabbed, but it can also happen spontaneously, right?
Yep, that's right. Pneumothorax is when air leaks into the pleural space, putting pressure on the lung so it can't expand properly. Like a balloon with a hole in it, the air escapes and it deflates. Trauma can cause it, but it can also just happen spontaneously, often from a tiny tear or rupture in the lung, like a lung springing a leak.
Like a puncture wound or a weak spot in the lung tissue. What are the signs someone has a pneumothorax?
Usually it's sudden, sharp chest pain, often with shortness of breath. Might also have a fast heartbeat, coughing, and a bluish tint to the skin, especially around the lips and fingertips. That means there's not enough oxygen. It's like your body sending out an SOS.
That sounds scary. How is pneumothorax treated?
Depends on the size of the pneumothorax and how bad the symptoms are. Sometimes it fixes itself if the leak is small, but often they'll put in a chest tube to drain the air and let the lung re-expand, like patching the hole in the balloon. And sometimes they need to operate to repair the tear in the lung and seal the leak permanently.
So pneumothorax can be serious, but thankfully they have ways to treat it.
Okay.
Let's move on to pulmonary edema, a condition affecting the lungs themselves.
Pulmonary edema, that's when fluid builds up in the tiny air sacs of the lungs, making breathing difficult. Imagine a sponge soaked with water can't hold any more air. It's often caused by problems with the heart, particularly heart failure. When the heart can't pump blood efficiently, the fluid backs up into the lungs.
So it's like a traffic jam in the circulatory system, with the lungs taking the hit. What are the usual symptoms of pulmonary edema?
Most commonly, shortness of breath, especially lying down. It's like trying to breathe underwater. That fluid fills the air sacs and you can't get enough oxygen. You might also wheeze, cough, have a rapid heartbeat, and feel like you're suffocating.
Sounds terrifying. How do they treat it?
They gotta fix the underlying problem, which is usually heart failure. Medications to help the heart pump better, remove excess fluid, and open up the airways are the usual treatment, like clearing the traffic jam and restoring the flow. In severe cases, they might need to give supplemental oxygen or even put the person on a ventilator to help them breathe while the heart recovers.
So it's all about getting that heart pumping properly again. Okay, let's talk about the mediastinum. What is it and why is it important when we're talking about surgery?
The mediastinum, that's the central compartment of the chest, right between the lungs. Think of it as the heart of the chest, literally. It houses the heart, big blood vessels, trachea, esophagus, lymph nodes, and more. Sometimes tumors can grow in the mediastinum, usually starting in the lymph nodes.
A central hub for important organs and structures. What signs should we watch for with a mediastinal tumor?
Symptoms really depend on the tumor size and where it's located. Some people don't have any symptoms at all, while others might have chest pain, shortness of breath, coughing, wheezing, trouble swallowing, or even swelling in the face or neck. Imagine a plant growing and disrupting the flow in that central hub. It can show up in different ways.
That makes sense. How are mediastinal tumors diagnosed and treated?
Imaging tests like chest x-rays or CT scans can usually spot the tumor. Then they might do a biopsy to confirm the diagnosis and see what type of tumor it is. Treatment depends on the type and how advanced it is. Could be surgery to remove it, radiation therapy, or chemo to shrink it. It's like coming up with a plan to deal with that disruptive plant.
Okay, so mediastinal tumors need careful assessment and a targeted treatment plan. Now, let's talk about something surgeons face in many procedures. Controlling bleeding. How do they manage that?
Controlling bleeding, or hemostasis, that's super important during surgery. Surgeons have a whole arsenal of techniques to start bleeding, each with its strengths. It's like a toolbox full of different tools for different jobs.
A multi-pronged approach to staunching the flow. What are some of those key techniques?
One common method is direct pressure, just pressing on the bleeding spot with gauze or a sponge, like plugging a leak with your finger. Then there's electrocautery, using a heated instrument to seal the blood vessels, like cauterizing a wound. Ligature is another technique, tying off blood vessels with sutures, like tying a knot in a rope to stop anything from passing through. And then there are hemostatic agents, substances that help clotting when applied to a wound, like a clotting accelerator.
So mechanical and chemical techniques. What about blood transfusions? When are those necessary?
Blood transfusions are used to replace blood lost from injury, surgery, or medical conditions that affect blood production. They can be lifesavers in emergencies, like severe bleeding or anemia, like refueling your car after it's run out of gas.
So it's about restoring the body's ability to carry oxygen and clot properly. What different types of blood transfusions are there?
They can transfuse different parts of blood depending on what the patient needs. Red blood cells are the most common to boost oxygen carrying capacity. Platelets help with clotting, and plasma replaces clotting factors and other proteins. It's like choosing the right type of fuel for your car.
So it's about targeting the specific deficiency. Now let's talk about a trend in surgery, minimally invasive techniques. What are the advantages of this approach?
Minimally invasive surgery, or laparoscopic surgery, is all about making tiny incisions and using special instruments and cameras to operate inside the body. Think of it as keyhole surgery. It's much less invasive than traditional open surgery with its big incisions.
So it's like choosing a smaller door to enter a room. What are the benefits?
There are quite a few. Smaller incisions mean less pain, faster recovery, smaller scars, and lower risk of complications. It's like taking a scenic route instead of a bumpy road, much smoother and less traumatic.
So it's a win-win for patients. What are some examples of surgeries that can be done using minimally invasive techniques?
Many surgeries can be done this way now. Gallbladder removal, appendectomy, hernia repair, hysterectomy, even some cancer surgeries. The technology and surgical skills have really advanced.
That's impressive. It's amazing how far surgical techniques have come. But even with those minimally invasive techniques, surgery is still serious and things can go wrong. What are some common surgical complications?
Some of the most common ones are bleeding, infection, problems with the wound healing, bad reactions to anesthesia, and damage to nearby organs or tissues. It's like navigating a maze. There are potential pitfalls along the way.
So it's important for patients to be aware of those risks, not just the benefits, before going under the knife. Now let's talk about anesthesia. What is it and how does it work?
Anesthesia is a way to control and temporarily block sensation or awareness so they can do surgery and other procedures. Think of it as a temporary pause button for pain and consciousness. There are different types depending on what they're doing and the patient's needs.
Like a customized sleep mode for the body. What are some of the different types?
General anesthesia is the most familiar one. They give you meds that knock you out completely and you don't feel any pain. It's like deep sleep. You're totally unaware of what's going on. Then there's regional anesthesia, where they numb a specific part of the body, like an arm or a leg, but you stay awake, like a localized force field against pain. And finally, local anesthesia just numbs a small area, like where they're giving an injection or a small wound, like a tiny shield just for that spot.
So choosing the right level of pain control for the situation. What about risks or side effects from anesthesia?
Like anything medical, there are some risks with anesthesia. Common side effects are nausea, vomiting, dizziness, and sore throat. Usually temporary and manageable. Serious complications are rare but can happen. Things like breathing problems, allergic reactions, and heart problems. It's a calculated risk. The benefits usually outweigh the risks, but you need to be aware of both.
Makes sense, like reading the fine print before signing on the dotted line. Okay, let's switch gears and talk about sterilization. How do they make sure surgical instruments and equipment are completely germ-free?
Sterilization means killing all the microorganisms, bacteria, viruses, spores, the whole gang. Like creating a completely sterile battlefield, no invaders allowed. Hospitals and clinics have a few ways to do this.
Eliminating any chance of infection. What are some of the common techniques they use?
Autoclaving is a big one, using high-pressure steam to kill everything, like a super-powered pressure cooker. Then there's dry heat sterilization, basically baking them to death in a dry oven. And chemical sterilization uses liquid chemicals, like disinfecting a surface. Each method has its pros and cons, but the goal is the same: make sure everything used in surgery is absolutely sterile.
A multi-pronged approach to creating a safe surgical environment. But even with all that, infections can still happen. What are some common types of surgical site infections?
Surgical site infections, or SSIs, are infections that happen right where the incision was made. Think of it as a breach in the body's defenses at its weakest point. They can range from minor skin infections to deep ones involving organs and tissues.
A range of severity then. So what are the different types of SSIs?
You've got superficial incisional SSI, where the infection's in the skin and the tissue right under it at the incision, like a small infection brewing just below the surface. Then there's deep incisional SSI, where it's deeper in the fascia and muscle. It's like the infection tunneling down. And finally, organ space SSI, where it's anywhere that was opened or touched during the surgery. That's the most serious one, a full-on invasion.
Like a battle against infection on multiple fronts. Okay, let's talk about imaging tests. What are some common ones used in surgery?
Imaging tests are like windows into the body, let surgeons see what's going on inside. X-rays are one of the basics, using radiation to create images of bones and dense tissues, like a shadow picture of your skeleton. Then there's CT scans, using X-rays and computers to create cross-sections, like slicing a loaf of bread and seeing all the layers. MRI scans use magnets and radio waves to create detailed pictures of organs and tissues, like a high-resolution photo of your insides. And ultrasound uses sound waves to create images. Think of it like sonar, mapping the underwater terrain.
So a diverse toolkit to visualize the body's internal structures. Your notes specifically mention an intravenous urogram, or IVU. What's that all about?
An IVU is an X-ray exam specifically for the urinary tract. They inject a special dye into your vein, and it travels to your kidneys, ureters, and bladder. As the dye goes through, they take X-rays to see the shape and function of those structures, like highlighting the plumbing to see how everything flows.
A roadmap of the urinary tract. Got it. What kind of conditions can an IVU help diagnose?
It can help diagnose a bunch of things, like kidney stones, blockages in the ureters, tumors, infections. It can also show how well the kidneys are working and the overall structure of the urinary tract, like a detective's tool for the urinary system.
Okay, so a useful tool for urological issues.
Yeah.
There's a condition sometimes seen in babies. An undescended testicle. What's that and why is it important?
Normally, a baby's testicles descend from the abdomen into the scrotum before birth. But sometimes one or both don't make it all the way down. That's cryptorchidism, or an undescended testicle. Think of it like a traveler who hasn't reached their destination.
A testicle gone astray. Why is it important to address this?
Well, an undescended testicle is more likely to develop cancer later on. It can also affect fertility because the higher temperature inside the body can mess up sperm production. Like trying to grow delicate plants in a harsh environment, they might not do well.
Makes sense. Early intervention is key then. How do they treat an undescended testicle?
Sometimes it comes down on its own in the first few months of life, but if not, they usually do surgery called an orchiopexy to bring it down and fix it in the right spot, like guiding that traveler to their destination and making sure they stay put.
So orchiopexy is a course correction for a wayward testicle. Now let's talk about another urological condition, bladder cancer. What are some risk factors for developing this type of cancer?
Bladder cancer is a malignant growth in the bladder, the organ that stores urine. Think of it like a cell going rogue and multiplying out of control. Several risk factors can make bladder cancer more likely.
Okay, so lifestyle choices and genetics can both play a role. What are the signs to watch out for with bladder cancer?
The most common symptom is blood in the urine, often painless. Big red flag, something's not right. You might also need to pee more often, have pain when peeing, or pain in the back, like alarm bells going off in the urinary system. If you have any of these, see a doctor right away.
Absolutely. Early detection is crucial. So how is bladder cancer usually diagnosed and treated?
They usually do a urine test to check for blood, a cystoscopy to look inside the bladder with a thin tube and camera, and a biopsy to confirm the diagnosis. Think of it as detective work. Treatment depends on the stage and how aggressive it is. Could be surgery to remove the tumor, radiation, or chemo to kill the cancer cells.
A comprehensive approach then. Now let's focus on the kidneys. The notes mention renal cell carcinoma, or RCC. What is that exactly?
RCC is the most common type of kidney cancer. It starts in the lining of those tiny tubes in the kidney that filter waste from the blood. Imagine that tiny filtration system being compromised by rogue cells.
Like a disruption in the kidney's filtering system. What are the risk factors for developing RCC?
Smoking, obesity, high blood pressure, and family history of RCC can all increase the risk. It's like a combination of lifestyle and genetics that creates a perfect storm for those rogue cells.
So it's a complex web of factors. What are some signs that someone might have RCC?
In the early stages, there might be no symptoms at all, which makes it tricky to catch early. But as it grows, it can cause blood in the urine, pain in the side or back, a lump in the abdomen, weight loss, and fatigue. It's like those rogue cells messing up the kidney's function and sending out distress signals.
Important to notice those subtle clues and get checked out. How is RCC typically diagnosed and treated?
Diagnosis usually involves imaging tests, like an ultrasound, CT scan, or MRI, to visualize the kidneys. A biopsy might be needed to confirm what type of tumor it is. Treatment depends on how advanced the cancer is. Could be surgery to remove the kidney or part of it, radiation or chemo to kill the cancer cells. It's like creating a plan of attack to target those rogue cells and stop them from spreading.
Okay, RCC sounds serious, needs a comprehensive treatment plan. Let's move on to a condition that affects the urethra. Urethral stricture, what's that?
A urethral stricture is when the urethra, the tube that carries urine out of the body, gets narrower. Imagine a kink in a garden hose, restricting the flow of water. This narrowing can make it hard to pee and lead to complications if left untreated.
A roadblock in the urinary pathway. So what causes a urethral stricture?
Lots of things can contribute. Injuries, infections, inflammation, past surgeries. It's like a chain of events that can damage or scar the urethra, causing it to narrow.
A roadblock on the urinary highway. What symptoms might someone with a urethral stricture experience?
The symptoms vary depending on how narrow the urethra is. Common signs include difficulty peeing, a weak or spraying stream, pain or burning when peeing, and recurring UTIs. Imagine trying to force water through that kinked hose. It's not going to flow smoothly.
Sounds uncomfortable. How are urethral strictures treated?
Treatment often involves widening the narrowed part. Could be using a dilator, like a tool to stretch the hose, or surgery to remove the blockage or rebuild the urethra, like clearing the roadblock to get traffic moving again.
Okay, got to restore that normal urinary flow. Now let's talk about kidney stones, a very common urological condition. What are they and what causes them?
Kidney stones are hard little crystals that form in the kidneys. Imagine tiny pebbles forming inside. They happen when there's a high concentration of certain substances in your urine, like calcium, oxalate, or uric acid. Think of it like a chemical imbalance, creating the perfect conditions for these crystals to form.
A crystallization process gone wrong. What are the typical signs of kidney stones?
Kidney stones can be incredibly painful. You get this sharp, stabbing pain in your side or back, often spreading down to the groin. It comes and goes in waves. Other symptoms include blood in the urine, nausea, vomiting, and even fever. It's your body saying, hey, something's wrong here.
Sounds excruciating. What's the treatment for kidney stones?
Depends on the size and where the stone is. Small ones might pass on their own with pain meds and lots of fluids, like flushing a small pebble out. Bigger ones might need to be broken up using shock waves, like a sonic hammer, or removed surgically. That's a more direct approach to clearing the blockage.
A tailored approach, then. Now let's discuss cystoscopy, a procedure used to diagnose and treat various urological conditions. What's involved in a cystoscopy?
A cystoscopy is a way for doctors to look inside the bladder and urethra using a thin tube with a camera, called a cystoscope. Think of it like a mini submarine exploring the urinary tract. They insert the cystoscope through the urethra and gently guide it into the bladder. The camera gives a real-time view, letting the doctor check for any problems.
A minimally invasive peek inside the urinary tract. What conditions can be diagnosed and treated with a cystoscopy?
It can diagnose lots of things: bladder cancer, bladder stones, UTIs, other bladder and urethra issues. It can also be used for treatment, like removing small bladder tumors or widening a narrowed urethra, a versatile tool that can explore and repair.
Okay, so a valuable tool for urologists. Now, what about a horseshoe kidney? A condition that affects the shape of the kidneys. What's that all about?
A horseshoe kidney is when the two kidneys are fused together at the bottom, forming a horseshoe shape. Imagine two beans stuck together. It's a birth defect, but most people with it don't have any issues and live normal lives.
So a variation in kidney anatomy that's usually harmless. Any potential problems with a horseshoe kidney?
While most people are fine, it can increase the risk of complications like kidney stones, UTIs, and hydronephrosis, the swelling of the kidney we talked about earlier. It's like those fused kidneys make it more difficult for urine to flow, increasing the chance of blockages and infections.
A more challenging plumbing system, then. Now, let's discuss radical prostatectomy, a procedure often used to treat prostate cancer. What does the surgery involve?
A radical prostatectomy removes the entire prostate gland and some surrounding tissues, including the seminal vesicles, like completely pulling out a weed, roots and all. They usually do it when the cancer's only in the prostate and hasn't spread.
A targeted approach to removing the cancer. Are there different ways to do a radical prostatectomy?
Yep, a few different ways, each with its own pluses and minuses. Open prostatectomy uses a traditional incision in the lower abdomen, like opening a door to get to the prostate. Laparoscopic prostatectomy uses several small incisions and special instruments with cameras. Think keyhole surgery for the prostate. And robotic-assisted laparoscopic prostatectomy is similar to laparoscopic, but the surgeon controls the instruments remotely with a robot, like using a high-tech joystick to do surgery.
So different tools for the same job, some more precise and less invasive than others. What are the potential side effects of a radical prostatectomy?
Like any surgery, there are potential side effects. The most common ones are urinary incontinence, trouble controlling urination, and erectile dysfunction, problems getting or keeping an erection. These can be temporary or permanent, depends on various factors.
A tough decision for men with prostate cancer, weighing the benefits of getting rid of the cancer against the potential impact on their life. Let's move on to a condition that affects the bladder. Bladder diverticulum. What's that all about?
A bladder diverticulum is basically a pouch that forms in the bladder wall. Imagine a little balloon sticking out of the bladder. It can be congenital, meaning you're born with it, or develop later, often because of high pressure in the bladder from a blockage or weak bladder wall.
Like a weak spot in the bladder that bulges out under pressure. What complications can happen with a bladder diverticulum?
Many people with this don't have any symptoms and don't even know they have it, but it can increase the risk of UTIs and bladder stones because urine can get stuck in that pouch. It can also make it hard to fully empty the bladder, like trying to drain a bottle with a dent in it.
A hidden reservoir for trouble. How is a bladder diverticulum treated?
If it's causing problems, like recurring infections or trouble peeing, they might need to do surgery to remove it. It's like patching the hole in the bladder to prevent more complications.
So it needs monitoring and possible intervention.
Yeah.
Okay, let's talk about a condition that affects men specifically. Phimosis. What is that exactly?
Phimosis is when the foreskin of the penis is too tight and can't be pulled back over the head of the penis, like a turtleneck sweater that's too tight to pull over your head.
Restricted foreskin movement. What causes phimosis?
It can be something you're born with or develop later, often because of infection or inflammation. The foreskin can get irritated or scarred, making it tighten up.
So congenital or acquired. What are the potential complications?
Phimosis can make peeing difficult or painful because the tight foreskin blocks the urine flow. It can also cause pain during erections and make infections more likely because bacteria can get trapped under the foreskin. If you don't address it, it can become a real problem.
Doesn't sound good. How is it usually treated?
They often use topical steroid creams to loosen the foreskin, like using fabric softener on that turtleneck to make it easier to pull over your head. Sometimes they might do a circumcision to remove the foreskin completely.
Okay, so it's treatable, but important to address it to avoid complications. Now, what about paraphimosis, another condition affecting the penis? How's that different from phimosis?
Paraphimosis, that's a urological emergency. It's when the foreskin gets stuck behind the head of the penis and can't be pulled back. Imagine that turtleneck getting stuck halfway over your head. Very uncomfortable, and it can be dangerous.
Like the foreskin strangling the penis head. What causes that?
It can happen if the foreskin stays retracted for too long, like during a medical procedure or sex, and isn't put back in its normal position. Like forgetting to pull that turtleneck back down after you take a peek.
Okay, makes sense. So what are the signs of paraphimosis?
You'll see pain, swelling, and discoloration of the penis head because the blood flow is restricted. If they don't fix it quickly, it can cause tissue damage, even gangrene. Got to restore that blood flow fast.
Definitely an emergency. How do they treat it?
They try to manually put the foreskin back, often using lubrication and pain meds to make it easier, like carefully maneuvering that turtleneck back down. If that doesn't work, they might have to make a small incision to free the foreskin.
Okay, so paraphimosis needs immediate attention to avoid serious problems. Now let's talk about epididymo-orchitis, a condition affecting the testicles and epididymis. What is that and what causes it?
Epididymo-orchitis is inflammation of the epididymis, the coiled tube that stores sperm, and the testicle. Like a fire breaking out in a warehouse, it can do a lot of damage. Usually it's a bacterial infection, often sexually transmitted.
An infection in those specific structures. What are the symptoms?
You'll see pain, swelling, and tenderness in the scrotum, fever, and maybe discharge from the penis. The whole area gets red, hot, and swollen. Classic signs of infection.
Sounds incredibly uncomfortable. How do they treat it?
Antibiotics are the main treatment to fight off the infection, like sending in firefighters to put out the blaze. Pain relievers and supportive care, like wearing a jockstrap and using ice packs, can help with the discomfort.
Okay, so it's treatable, but important to get it checked out quickly to avoid complications. We talked about kidney stones earlier, but your notes also mentioned bladder stones. How are those different?
Bladder stones are hard crystals that form in the bladder, just like kidney stones form in the kidneys. Imagine tiny pebbles collecting in a reservoir. They can form for different reasons: chronic bladder infections, blockage of the bladder outlet, even foreign objects in the bladder.
So the same type of crystal formation, just in different locations. What are the symptoms of bladder stones?
Bladder stones can cause pain in the lower abdomen, blood in the urine, trouble peeing, and frequent UTIs. It's like those pebbles irritating the bladder and blocking the flow of urine.
Not fun. How are they usually treated?
Often they use shock waves to break up the stones, like a sonic hammer, or they might do surgery to remove them. It's about choosing the right tool to get rid of those pesky pebbles.
Okay, bladder stones, like kidney stones, need to be dealt with. Let's talk about bladder slings, a procedure used to treat urinary incontinence. What is a bladder sling, and how does it work?
A bladder sling is surgery to support the urethra and stop urine leakage, like a hammock holding up a weak branch. They put a strip of synthetic material or mesh under the urethra to lift it up and give it extra support.
A reinforcement for the urethra. What kinds of bladder slings are there?
There are different ways to put in the sling, each with pros and cons. A retropubic sling goes in through an incision in the abdomen, like approaching the urethra from above. A transobturator sling goes in through incisions in the groin, approaching it from the sides.
Different paths to the same destination. What are the risks and complications of a bladder sling?
Like any surgery, there are risks, like infection, bleeding, pain, and the mesh eroding. Important to talk to your doctor about these before deciding on a bladder sling.
So it's a potential solution for incontinence, but weigh the benefits and risks. Let's discuss TURP, transurethral resection of the prostate, a procedure for an enlarged prostate. What is it and how's it done?
A TURP is where they remove extra prostate tissue that's blocking urine flow, like pruning an overgrown bush to open up the view. They use a special instrument called a resectoscope, inserted through the urethra. It has a little loop that uses heat to cut away the extra tissue, which is then flushed out of the bladder.
A minimally invasive prostate trim. Any risks or complications with a TURP?
There are some risks like bleeding, infection, retrograde ejaculation where semen goes into the bladder instead of out the penis, and urinary incontinence. Always talk to your doctor about these risks beforehand.
Okay, 2RP is a common treatment for BPH, but good to know the potential downsides. Let's talk about penile cancer. What is it, and what are the risk factors?
Penile cancer, that's a rare type of cancer that starts in the skin or tissues of the penis. It's like a rogue cell breaking all the rules and multiplying like crazy. Several things can increase the risk of developing penile cancer.
A rare cancer, but good to be aware of. What increases a man's risk?
Some of the risk factors are not being circumcised, having HPV infection, smoking, and having a weakened immune system. It's like a combination of things creating the perfect environment for those rogue cells to take over.
Lifestyle choices, infections, and overall health all playing a role.
Yeah.
What are some signs that a man might have penile cancer?
It can cause sores or lumps on the penis that don't heal, changes in skin color, discharge, and bleeding. Those rogue cells are messing with the penis's normal function and sending out distress signals. If you notice any of these things, see a doctor right away.
Absolutely. Early detection is key for any cancer. How is penile cancer usually treated?
The treatment depends on how advanced the cancer is. Could be surgery to remove the tumor, radiation therapy, or chemo to kill the cancer cells. It's like developing a strategy to attack those rogue cells and stop them from spreading.
Okay, a comprehensive approach to treatment is needed. We talked about circumcision earlier, but your notes also mention a hydrocolectomy. What's that?
A hydrocolectomy is surgery to remove a hydrocele, that fluid-filled sac around a testicle that causes swelling in the scrotum. It's like draining a water balloon that's formed around the testicle. They make a small incision in the scrotum, remove the sac, and the testicle goes back to its normal spot.
A relatively simple fix for that swelling.
Yeah.
We also talked about vasectomy, a permanent form of birth control for men. Your notes mention a vasectomy reversal. What's that, and why would someone need it?
A vasectomy reversal reconnects the tubes that were cut during a vasectomy. It's like untying a knot in a rope. Guys might want this for different reasons. Maybe their life circumstances changed, they want more kids, or they regret having the vasectomy.
A second chance for those who change their minds. Is it always successful?
The success rate depends on a few things, like how long ago the vasectomy was, the surgeon's skill, and the patient's overall health. It's not a guaranteed fix, but it offers hope for those who want to have kids again.
So it's an option, but it's important to be realistic about the chances of success. Now, what about Peyronie's disease? Another condition that affects the penis. What is it?
Peyronie's disease is when scar tissue forms inside the penis, making it curve or bend during erections. Imagine a flexible rod becoming bent or misshapen. It can make it difficult to, function properly.
A structural problem with the penis. What causes Peyronie's disease?
The exact cause is a bit of a mystery, but it seems to be related to injury or inflammation of the penis. It's like a wound healing the wrong way, leaving behind scar tissue that messes up the shape and function of the penis.
Okay, a bit of a mystery, but trauma or inflammation seems to be involved. What are the symptoms?
The symptoms can vary, but common ones are pain during erections, curvature of the penis, and difficulty having intercourse. It's like that bent rod causing discomfort and making it hard to fit where it needs to.
Doesn't sound fun. How do they typically treat Peyronie's disease?
Treatment depends on how severe the symptoms are and how much it's affecting the man's life. Sometimes meds can help reduce the scar tissue and improve things, like trying to soften that bent rod. But if that doesn't work, they might need surgery to straighten the penis and get it working properly again.
Okay, a potentially challenging condition to treat, but there are options. Your notes also mention a penile biopsy. What is that?
A penile biopsy is when they take a small piece of tissue from the penis to look at under a microscope. Imagine taking a tiny core sample to analyze what's in it. Usually they do it to diagnose penile cancer, but they can also use it to diagnose infections or skin problems.
A detective's magnifying glass for the penis. How do they do a penile biopsy?
Usually it's done with local anesthesia, so they numb the area first. Then the doctor uses a small needle or scalpel to take the tissue sample. It's like taking a tiny pinch to examine under the microscope.
Okay, so a relatively minor procedure that can give valuable information. Now, let's talk about a condition that can affect both men and women, condyloma acuminata, or genital warts. What are they and what causes them?
Genital warts are small bumps that show up in the genital area. They can be flesh-colored or grayish. Think tiny cauliflower-like growths. They're caused by HPV, the human papillomavirus, a super common sexually transmitted infection.
I've heard HPV is really common. How common are we talking?
It's incredibly common. Most sexually active people will get HPV at some point in their lives. It's like the common cold of STIs, very contagious. But most infections go away on their own without causing any trouble. The problem is that some types of HPV can cause genital warts or even cancer.
A virus with a range of potential consequences then. What are the typical symptoms of genital warts?
Well, the warts themselves are the main symptom. They can be flat or raised, single or in clusters. Imagine little bumps popping up on the genital landscape.
Okay, doesn't sound pleasant at all. How are genital warts usually treated?
There's no cure for HPV itself, but there are ways to get rid of the warts, like topical creams, freezing, or surgery. It's like trying to prune those unwanted growths. But even after the warts are gone, the virus might still be hanging around and could cause new warts in the future.
So it's a battle against the symptoms, not a cure. Let's switch gears and talk about a condition that affects the liver. An amoebic liver abscess. What is that and what causes it?
An amoebic liver abscess is a pocket of pus in the liver caused by a parasite called Entamoeba histolytica. It's like a tiny invader setting up camp in the liver, causing inflammation and pus. Usually it comes from contaminated food or water, which is why it's more common in developing countries where sanitation isn't as good.
A parasitic invasion of the liver. What are the symptoms?
Symptoms vary depending on the size and location of the abscess. Common ones include fever, chills, pain in the upper right abdomen, and an enlarged liver. The liver gets inflamed and swollen because of that parasitic infection.
Sounds pretty nasty. How do they treat amoebic liver abscesses?
Usually they use medications to kill the parasite, meds like metronidazole or tinidazole. It's like sending in special forces to wipe out the invaders. Sometimes they might need to drain the abscess to get rid of the pus and relieve pressure on the liver.
So a serious condition, but treatable. Now let's talk about obstructive jaundice, a condition that affects the flow of bile. What causes that?
Obstructive jaundice is when something blocks the flow of bile from the liver to the small intestine. Think of it like a clogged pipe backing up sewage. This blockage causes bilirubin to build up in the bloodstream. Bilirubin is a yellow pigment that's produced when red blood cells break down.
A traffic jam in the bile duct, backing up bilirubin. So what are some common causes of this blockage?
A few things can cause it: gallstones, tumors, and inflammation of the bile duct. Think of them as roadblocks on the bile highway.
Got to remove those roadblocks. What are the signs that someone has obstructive jaundice?
The most obvious sign is when the skin and whites of the eyes turn yellow. That's jaundice. It's like the body's turning yellow because of all that bilirubin. You might also have dark urine, light-colored stools, itchy skin, and abdominal pain, like the body's sending out distress signals trying to deal with that blocked bile flow.
Visual and physical clues. How is it diagnosed and treated?
They'll do blood tests to check bilirubin levels, imaging tests like ultrasound or CT scans to see the bile duct and find the blockage. Sometimes they do a procedure called ERCP, endoscopic retrograde cholangiopancreatography, to get a good look at the bile duct and maybe remove the blockage. Treatment depends on what's causing it. Gallstones might need to come out, tumors might need surgery, radiation, or chemo, and inflammation might need meds. It's like calling in a plumber to clear that clogged pipe.
Okay, so fix the underlying problem. Now, let's talk about portal hypertension, another condition that affects blood flow in the liver. What is portal hypertension?
Portal hypertension is high blood pressure in the portal vein, the one that carries blood from the intestines to the liver. Imagine a huge traffic jam on a major highway leading into a city. It causes congestion and disrupts everything. This high pressure can lead to serious problems as the blood backs up into other vessels.
A pressure buildup in the liver circulation.
Yeah.
What causes it?
The most common cause is cirrhosis, where the liver gets scarred and damaged, often from drinking too much alcohol, hepatitis B or C, or fatty liver disease. Think of it like the city's infrastructure crumbling, making it tough for traffic to flow smoothly.
Cirrhosis, a major roadblock in the liver's circulatory system. What are the potential complications of portal hypertension?
It can cause all sorts of serious problems: enlarged veins in the esophagus and abdomen, fluid building up in the abdomen, that's ascites, and internal bleeding. It's like that traffic jam causing detours and backups, leading to even more problems.
That's definitely worrying. How is it managed?
The focus is on managing those complications and slowing down the liver damage. Sometimes meds can help lower the pressure, like trying to ease the traffic. But in severe cases, they might need procedures to create new pathways for blood flow or even a liver transplant if the liver is really damaged.
So addressing both the cause and the consequences. Now let's discuss hepatocellular carcinoma, or HCC, another condition affecting the liver itself. What is HCC?
HCC is the most common type of liver cancer. It's a malignant growth that starts in the liver cells, like a rogue cell, breaking all the rules and multiplying out of control right in the liver.
A cellular rebellion in the liver. What are some things that increase the risk of developing HCC?
Chronic hepatitis B or C infections, cirrhosis, and alcohol abuse are all risk factors. It's like they create the perfect environment for those rogue cells to party and multiply.
Viruses, liver damage, and lifestyle all playing a role. What signs should someone look out for?
The tricky thing is, there might not be any symptoms early on, which makes it tough to catch early. But as it grows, it can cause abdominal pain, loss of appetite, weight loss, jaundice, that yellowing of the skin and eyes, and swelling in the abdomen. It's those rogue cells messing with the liver's normal function and sending out distress signals.
A silent invader that only reveals itself when it's already taken hold. How is HCC usually diagnosed and treated?
They'll often do imaging tests, like ultrasound, CT scans, or MRI, visualize the liver, blood tests to check liver function, and a biopsy to confirm the diagnosis. It's like gathering evidence to build a case against those rogue cells. Treatment depends on the stage and might include surgery, radiation, chemo, or a combination. Sometimes a liver transplant might be an option too. It's like developing a battle plan to fight those cells.
Okay, so HCC needs a multi-pronged approach to treatment, like many other cancers. Let's talk about a rare condition that affects the pancreas. An annular pancreas. What's that all about?
An annular pancreas is a rare thing where a band of pancreatic tissue wraps around the duodenum, the first part of the small intestine, like a ring or a belt squeezing the duodenum.
So it's a developmental quirk. The pancreas forms abnormally. What causes this to happen?
It happens during fetal development. The pancreas doesn't form right. We don't know exactly why, but it's probably a mix of genes and environmental factors.
A developmental mishap then.
Yeah.
What problems can an annular pancreas cause?
It can block the duodenum, so food can't pass through properly. This can cause vomiting, abdominal pain, and in babies, they might not grow and develop as they should. That ring of pancreatic tissue is like a clamp on the duodenum, messing up its normal function.
Definitely a serious problem, especially for babies. How do they treat it?
Usually surgery to bypass the blockage so food can get through, like creating a detour around a roadblock.
Okay, surgery to fix that developmental problem and get things flowing again. Now, shifting gears to a condition affecting the brain and spinal cord, a meningocele. What is it and what causes it?
A meningocele is a type of birth defect, a neural tube defect. Happens when the spinal cord doesn't close completely during pregnancy, and you get a sac of fluid sticking out from the back. Imagine a zipper that doesn't close all the way, leaving a gap.
A developmental error in the central nervous system. What causes it?
We don't know for sure what causes neural tube defects like this, but it's probably a mix of genes and things in the environment, like not getting enough folic acid during pregnancy.
A complex set of factors then. What are the potential consequences of a meningocele?
It depends on how big the defect is and where it is. Some babies with this don't have any symptoms, while others might have paralysis, bowel or bladder problems, or developmental delays. It's like ripples spreading out from that initial defect.
So the severity can vary quite a bit. How's it treated?
Usually surgery to close the defect and protect the spinal cord, like fixing that zipper to prevent more damage.
Surgical intervention is key. Let's move on to another brain condition. Hydrocephalus. What is it and what causes it?
Hydrocephalus is when you have too much cerebrospinal fluid, CSF, in the brain. CSF is a clear fluid that surrounds the brain and spinal cord, cushioning and protecting them. It's like a waterbed for the brain.
A fluid imbalance in the brain's protection system. So what causes this buildup of CSF?
It can be a blockage in the flow of CSF, or the body might be making too much of it, or it might not be absorbing it properly. Think of it like plumbing problems. A clogged pipe, a leaky faucet, a drain that's not working.
Lots of potential plumbing issues. What are the signs of hydrocephalus?
The symptoms depend on the person's age and how severe it is. In babies, you usually notice a really big head because their skull bones haven't fused yet and can expand to fit all that extra fluid. Other symptoms can include vomiting, sleepiness, irritability, and seizures. In older kids and adults, they might have headaches, nausea, vomiting, blurry vision, and problems with balance and coordination. It's like the brain sending out distress signals because of the pressure.
Different presentations in babies and adults. How do they treat it?
Usually surgery to put in a shunt, a device that drains the extra CSF from the brain to somewhere else in the body, like the abdomen, where it can be absorbed, like creating a detour for the CSF to bypass the blockage.
Like a pressure relief valve for the brain.
Okay.
The notes mention a depressed skull fracture. A specific type of skull fracture. What is that?
A depressed skull fracture is when a piece of the skull bone gets pushed inward towards the brain. Imagine denting a ping pong ball. That dent is the depressed fracture. It's usually from a blow to the head with something blunt.
The skull caving in. What can happen because of this?
The symptoms can vary depending on how bad the fracture is and if there's any brain injury. Some people have headaches, dizziness, nausea, vomiting, seizures, or even pass out. If it's really bad, the fracture can damage the brain tissue, leading to neurological problems.
Like a ripple effect from that impact. How do they treat depressed skull fractures?
Again, it depends on how severe it is and if there's brain injury. Some fractures heal on their own with rest and pain meds. Others might need surgery to lift those broken pieces of bone and repair any damage to the brain.
So they assess each case individually. Your notes mention the Glasgow Coma Scale, a tool used to assess consciousness after a head injury. What's that?
The Glasgow Coma Scale, or GCS, is a way to assess how conscious someone is after a head injury. It looks at three things: eye-opening, verbal response, and motor response. Each one gets a score, and they add up the scores to get a total score. Lower score means more severe injury.
A standardized way to measure consciousness. How do they interpret the score?
The score ranges from 3-15. A 15 means the person's fully alert and oriented. A 3 means they're in a deep coma. The score helps doctors understand how bad the injury is and make decisions about treatment.
A helpful tool for head injuries.
Hmm.
We talked about flail chest earlier, but you mentioned some additional complications that can happen.
Right. Besides the trouble breathing, because of that paradoxical chest wall movement, flail chest can cause other problems too. One is pulmonary contusion, basically a bruise on the lung tissue from the impact. Another is pneumonia, an infection in the lungs, which can happen when breathing's not good and secretions build up. Think of those complications like secondary waves hitting the shore after a tsunami.
A cascade of potential problems. How do they manage those complications?
They focus on supporting the body, managing the pain, giving oxygen, and sometimes putting them on a ventilator to help them breathe. If they have pneumonia, they might need antibiotics, and it's crucial to watch them closely for any other complications.
Supporting the lungs while they heal and preventing further damage. We also discussed tracheostomy, but you mentioned that it's sometimes needed long-term. Can you explain that?
Sure. A tracheostomy is often an emergency procedure to create an airway, but it can also be planned in advance if someone needs help breathing or clearing their airway for a long time. Think people with spinal cord injuries, strokes, neuromuscular diseases, or severe airway blockages. The tracheostomy tube gives them a reliable airway and makes it easier to suction out secretions.
A long-term solution for chronic breathing problems. Okay, let's talk about emphysema, a condition often caused by smoking. What is it, and how does it affect the lungs?
Emphysema is a long-term lung disease that destroys those tiny air sacs in your lungs, the alveoli. It makes breathing really difficult. Think of those alveoli like tiny balloons that help with gas exchange. Emphysema makes those balloons lose their stretchiness and collapse, so your lungs can't transfer oxygen into the blood and remove carbon dioxide as well.
A gradual breakdown of the lung's ability to function. I've heard emphysema is one of the diseases that falls under COPD, chronic obstructive pulmonary disease. Is that right?
That's right. COPD is a group of lung diseases that make it hard to breathe because airflow is blocked. Emphysema and chronic bronchitis are the two main culprits in COPD. It's like two villains teaming up to attack your respiratory system.
A double whammy for the lungs. What symptoms would someone with emphysema typically experience?
The most common symptom is shortness of breath, especially when you exert yourself. As those alveoli get damaged and the lungs lose their stretchiness, it gets harder to breathe out all the way. That leads to air trapping and feeling breathless. You might also wheeze, cough, and feel tightness in your chest.
A steady decline in breathing capacity. How do they treat emphysema?
Sadly, there's no cure for emphysema, but there are treatments to manage the symptoms and slow it down. These can include medications to open up the airways, pulmonary rehab to help with breathing techniques and exercise, and supplemental oxygen if blood oxygen levels are low. In really severe cases, a lung transplant might be considered.
Okay, so managing the symptoms and slowing the progression. Let's discuss bronchoscopy, a procedure often used to diagnose and treat lung cancer. What is it, and how is it performed?
Bronchoscopy is a way to look inside the airways, the trachea, bronchi, and bronchioles, using a thin, flexible tube with a camera on the end called a bronchoscope. Think of it as a mini submarine exploring your lungs. They put the bronchoscope in through the nose or mouth and guide it down, letting the doctor see the lining of the airways and look for anything unusual.
A minimally invasive way to check out the respiratory system. What conditions can they diagnose and treat with a bronchoscopy?
They can use it to diagnose all sorts of lung problems like lung cancer, infections, inflammation, blockages. They can also take biopsies during a bronchoscopy or remove foreign objects that might have been inhaled. It's a versatile tool, good for both diagnosis and treatment.
A valuable tool indeed. Okay, let's shift gears and talk about the ICU, the intensive care unit. What is it, and what kind of patients end up there?
The ICU is a special unit in a hospital for people with life-threatening illnesses or injuries who need constant monitoring and advanced life support. It's like a high-tech haven for the critically ill.
So the sickest patients are in the ICU. What types of medical conditions or injuries would land someone in the ICU?
Usually, it's conditions that need constant monitoring and help with vital functions. Could be respiratory failure needing a ventilator, heart failure needing meds to support the heart, severe infections needing IV antibiotics, major trauma or surgery that needs intensive post-op care.
The most serious cases. What kind of medical professionals work in the ICU?
It's a whole team effort in the ICU. You've got critical care physicians, nurses who specialize in intensive care, respiratory therapists, pharmacists, nutritionists, physical therapists, all working together to take care of these complex patients.
A true collaboration to manage those critical needs.
Mm-hmm.
What are some of the challenges of working in such a high-pressure environment?
Working in the ICU is tough, but it's also rewarding. It's fast-paced, the patients are really sick, and you're dealing with life and death situations all the time. It can be emotionally draining. But it's also incredibly rewarding to make a difference in the lives of these patients and support their families during such difficult times.
A demanding but impactful specialty. Let's talk about informed consent, a crucial part of ethical medical care. What is informed consent, and why is it so important?
Informed consent is all about getting the patient's permission before doing any medical procedure or treatment. It's based on the idea that patients have the right to make their own choices about their health care. It's all about respecting the patient and making sure they understand what they're getting into.
So it's not just about signing a form. It's about a real conversation and making sure the patient is fully on board. What are the essential parts of informed consent?
It's a conversation between the doctor and the patient. The doctor explains everything about the procedure or treatment, the risks, the benefits, other options, what might happen if they don't get the treatment. Then the patient can ask questions, clear up any confusion, and make their own decision based on what they've learned. It's a team effort. The doctor provides the expertise, and the patient has the final say.
A shared decision-making process. Okay, let's talk about advanced directives, which are becoming increasingly important, especially in end-of-life care. What are advanced directives and why are they important?
Advanced directives are legal documents that let people say what they want for their medical care if they can't speak for themselves because of illness or injury. Think of it as your voice for the future, making sure your wishes are followed even if you can't speak up.
A blueprint for future healthcare decisions. What are some examples of advanced directives?
Two common ones are a living will and a durable power of attorney for healthcare. A living will outlines what you want for life-sustaining treatments. Things like ventilators, feeding tubes, resuscitation if you become terminally ill or permanently unconscious. It's like a roadmap for end-of-life care. A durable power of attorney for healthcare is where you choose someone you trust to make medical decisions for you if you can't.
So advanced directives help ensure your wishes are followed. Now, while we're on the topic of end-of-life care, let's talk about palliative care. What is it, and how is it different from hospice care?
Palliative care focuses on relieving symptoms, pain, and stress for people with serious illnesses. It's about improving their quality of life, no matter the prognosis. Hospice care is a type of palliative care, but it's specifically for people who are terminally ill and expected to live 6 months or less. Palliative care can be provided alongside treatments meant to cure the illness, while hospice care is typically provided when those treatments are no longer an option.
So, improving quality of life at any stage versus focusing on comfort and support in the final stages. Well, we've covered a lot of ground today, from breast cancer to hernias to the intricacies of the liver and the brain. It's been quite a deep dive.
Absolutely. We've explored a wide range of surgical and oncological conditions, touching on everything from diagnosis to treatment to the ethical considerations of medical care.
Remember, folks, this deep dive was designed to help you grasp those complex medical concepts and get you prepped for that exam. Keep those images in mind. Those helpful analogies can be real lifesavers when you're trying to remember everything.
And don't forget, understanding these conditions can empower you to take control of your own health or even help others. Knowledge is power, after all.
We hope you've enjoyed this deep dive and found it helpful. Now go out there and ace that exam.